Have you ever considered naturopathic medicine as an additional resource for your health conditions? Believe it or not, the World Health Organization estimates 65 to 80% of the population use holistic naturopathic medicine as a primary form of healthcare. In fact, Americans make more visits to holistic healthcare providers than to their MDs and spend more money out of pocket to do so. Today, we are talking with Dr. Sasha Coleman, a naturopathic who deals with holistic energy and biometric medicine. Are you ready for another chronic pain conversations? Let's go. Hello, and welcome to Chronic Pain Conversations, a show that is open and honest and has dialogue about chronic pain and the vast variety of different conversations that need to happen around it. My name is Kalila Griswold, aka The Overcomer, and normally you see two of us, but today Miss Sharifa McLaren is taking a day off to heal herself. So we are sending her all the love in the world. So, as usual, whether she's here or not, we're going to start off with something that Sharifa loves to do all the time: pain and pleasure. So, my update for today is that I'm actually in a 50-50 with pain and pleasure. Uh, Pleasure, because I'm starting to see the effects of my first surgery that I did with my lymphedema. So there's such amazing things that are happening. I'm starting to hike, I'm starting to move, and some of my pain is being minimalized. So I am so thankful now that it's been just over a month. The pain part is that my knee still hurts a little bit, but I'm in school right now and I'm not moving around too much. So I'm very, very thankful about everything that's going on. I'm really excited about today, you guys, because we're bringing on a conversation that we actually haven't been able to have before in the last 4 seasons, but today we get to have it. We've had so many people talk about naturopathic or want to know about naturopathic medicine. And today, to end Black History Month, we have a naturopathic who's going to come on and have a conversation with us. I'm really excited. But let's talk about something. Did you know that this week is Pink Shirt Day? That's right. I've got mine on. Got mine straight from Texas as I was coming through to California. Do you know what Pink Shirt Day is? It's a day where the world stands up against bullying. And so we just want to advertise for you that tomorrow, put on your pink shirt. Let the world know that that you stand against bullying and that you don't appreciate it, especially if you got kids or nieces, nephews, sisters, or brothers that you know that it's been affected by, or even if you've been affected. And one of the things that we want to bring up here in Chronic Pain Conversation is as chronic pain conquerors, sometimes we get bullied. Sometimes we hear, you're not doing enough. You should be moving more. You're lazy. All of these different things that come from family, friends, and the outside world. And we're just trying to keep our sanity while we deal with our pain and try to live like the best as we can. So tomorrow, make sure that you post, make sure that you tag, make sure that you wear your pink shirt tomorrow. Okay? So what I'm about to do is bring on an amazing, amazing woman that's done so many things. And I can't wait to bring her on for today. So Dr. Sasha Coleman has been working with At Heart. I'm going to remember this. I'm going to try and remember this. And it's a clinic that deals with holistic medicine. And I can personally say that I haven't gone into complete holistic medicine, but I have been using so many different alternatives. And we are always advocating about other options that are on there that are available to you. So today I get to bring her on. Are you guys ready? Let's go. All right, here we go. Miss Doc, I keep saying Miss when I should be saying Dr. Sasha. How are you
I'm
today?
both, so it works. I'm good. I'm good. How are you doing?
Doing well. From the
Awesome.
bottom of my heart, I know that Sharitha is not here, but we
Mhm.
want to say thank you, thank you, thank you so much for joining us today. You're about to bring us so much knowledge and expertise, and you're about to do so many different things. So, to start us off, how about you introduce yourself and tell us exactly what your official service title is
Mhm.
and what it is that your first official title. Let's start with that.
Yeah, so I'm Dr. Sasha Coleman. I'm a naturopathic doctor. I went to one of the 7 accredited naturopathic medical schools in North America. I went to Southwest College, which is in the beautiful Phoenix, Arizona. Did my degree out there, and then just recently I've moved back home to Toronto, so it's been really nice.
Wow. Okay.
Mhm.
So when I was reading your bio, you
Mhm.
had a lot of information about treatments, alternative medicine, and I
Mhm.
kind of want to go through a couple of them because I'm hearing words, and some of our chronic pain conquerors that are watching this are
Mhm.
about to hear words that they've never heard before.
Right.
So let's start with acupuncture. It's
Mhm.
pretty a word that we normally hear, but
Mhm.
explain what acupuncture is and what you do to help the chronic pain community with that.
Yeah, so acupuncture is just one of the various things that fall under the umbrella of traditional Chinese medicine. So,
Mhm.
traditional Chinese medicine has specific herbs that you can use. There's other treatments like cupping. I know Michael Phelps got that really popular back in the Olympics a few years ago. And then acupuncture. But with acupuncture, the thing that I think most people know of is it's needles, and a lot of people are kind of afraid of needles, but the needles are so thin. They're thinner than like the butterfly needle that you would put in a child to get a blood draw, right?
They are.
And these needles are so therapeutic, and they're applied in such a specific way to really help open up the channels. That's part of the theory in traditional Chinese medicine for opening up the channels. And in relation to the chronic pain community, one of the theories in Chinese medicine is about Bai syndrome. So, Bai syndrome is a specific diagnosis that really has to do with pain. And what we often see with pain is that it's a form of stagnation in Chinese medicine. And so, stagnation, when that happens, it's kind of like when something builds up in one spot, and that's kind of what's causing the pain. So, what that treatment focuses on is really just relieving that area of stagnation to alleviate pain. So that's just one of the various like diagnoses that you can have in acupuncture to really help treatments of pain.
Now, I do acupuncture currently, and I've probably been doing it for at least the last 3 or 4 years since I had my initial car accident.
Mm,
And I can honestly say there's so many different like there's things that people don't know. Like, yeah, a lot of people are scared about
mhm,
this.
mhm,
If you have, and everybody's got a different technique, but there
mhm,
are a lot of acupuncturists that have a very light touch that it's either a very thin prick or it's less than actually feeling like you got stuck with a needle.
yeah,
You know, everybody thinks like your needles when you get your blood so
yeah,
much more thinner, you know?
exactly,
And then they
exactly.
get long and you get scared because they're long and you're like, what is that? But
Right, right.
feel it.
Mhm,
I have electrodes that are
mhm.
attached to mine in certain areas to kind of waken up the sensations a little bit.
Nice.
But I have to honestly say that, and I think that's the other thing. People don't realize it can go in so many different places. It's
Mhm,
been used in my knee and in my
mhm,
back and in my
mhm,
spine and in my
mhm.
head. And it can unblock areas that are so blocked up and we don't even think about it. So
Mhm,
even with my knee, he's putting needles in my upper thigh,
mhm.
and it's relieving the tension that needs to go down into my knee. So
Exactly.
so this is amazing.
Yeah.
Talk to me about, okay, constitutional hydrotherapy.
Yeah, it's a mouthful.
It's a mouthful, but it's a good word. So
Yeah.
explain to me what that is. Is that like hyperbaric chamber? What does that look like?
Not even. It's a really simple treatment. So when we say constitutional, what we mean is that it's something that's going to affect our entire constitution or our entire body. So pretty much we're applying hot and cold towels to pretty much right under the neck here to right above your waist. And so
Right.
what that's doing is causing circulation to increase to all of those vital organs in both the front and the back. So we're getting the liver, the kidneys, the gallbladder, all of your digestive tract. So the lungs, if you have any condition involving any of these vital organs, it's going to affect it. So pretty much what you do is we just use heated towels first. That's applied for about 5 minutes on the front. Then is the cold phase. So then we put cold, like one layer of a cold towel, as cold as the person's tolerance can take. And you keep that on until the body is warmed back up. Then essentially we do the same thing on the back. But pretty much what that's doing is increasing blood flow to all of those vital organs. So in naturopathic medicine, we're really just trying to support the body to do what it knows how to do already, right? We're just trying to help it have the tools it needs for proper healing. And blood is one of the best ways to do so. Blood has our immune cells, it has the things to help for cellular repair and all that it needs essentially. So we're just helping the body along to really do all of that healing that it needs to do.
So, number one, the first thing that I'm so appreciative of is
Mhm,
that you said to what the patient can tolerate. So,
mhm,
when you have someone such as myself and chronic pain conquerors, some people are sensitive, really sensitive to cold, and some
right.
people are really sensitive to heat. So,
Mhm,
you work with them to make sure that they're comfortable through it.
definitely.
Now,
Like, sorry, and just to add to that, if someone has something like Raynaud's or something, you can't really do those cold applications because that could make them a little worse.
mhm.
Or, a situation if someone has an active ulcerative colitis flare, they're not going to do that right then. We want to wait until you're more of in a calm state, not during an acute flare up of like some digestive issues and things like that. So it's supposed to be a very gentle, calming, really relaxing, honestly, treatment for the body.
You said keywords gentle and calming. We
Yeah,
love
nice.
Let
And
me
I
tell you,
put like aromatherapy in there as well too, so it's nice.
always good.
Mhm,
Now, when I hear you talking about this hypotherapy, hydrotherapy, the
mhm,
first thing that comes to my mind, if you're Canadian, is
mhm,
the polar bear ice. Like,
mhm.
I think about at the beginning of the year when everybody just goes in because, and athletes do it as well. These are things
Yeah,
that we don't consider. They take
mhm,
the ice bath. And so a
exactly.
lot of people think it's not good,
Mhm,
but it shocks the system. It
mm,
kind of gets it back running. So
exactly.
is this hydrotherapy kind of in that same form, same comment in terms of setting it up?
Yeah,
And
definitely, definitely. So there are so many different reasons why you want to use hot applications or applications. And one of the key things with especially chronic pain is inflammation, right? And I'll keep coming back to that. Inflammation is kind of the root issue that we really want to address with a lot of pain
right.
situations. But as far as hydrotherapy, that's why it's such an excellent application. So the cold phase is what's causing a lot of vasoconstriction, right? So if you are very inflamed, if your blood vessels have been like engorged and there's a lot of pain, or for those athletes that have been working out really hard, they have a lot of blood flow going. And so you just got to calm the body back down. So that's why those ice baths are used.
Right.
But for the purpose of the constitutional hydrotherapies that I do, it's more of that pumping action that I'm going for. So the vasodilation from the hot and the vasoconstriction from the cold is helping improve circulation by causing a pumping action to start going to each of these organs.
Hmm.
So that's, yeah.
So is it helping to develop like your sensitivity and things like that? So as a fibromyalgia fighter,
Mhm.
when I'm hearing inflammation, does it help reduce my inflammation, help reduce my pain,
Yeah.
help kind of get me moving when I feel very stiff, things like
Yeah,
that?
exactly. So a lot of the issue is just like stagnation. Your lymph is not able to move, your blood is not able to move. And so by just getting that pumping action going, you're really going to start healing and you're bringing those immune cells to help decrease inflammation by doing so as well.
Okay, this is amazing.
Hmm.
Now, the next word that I heard that I never, and it was weird because I heard botanical medicine. And
Uh-huh.
it's really funny because when I hear that, I actually think of more of that Chinese medicine, that Eastern medicine. I
Mm-hmm.
think about our West Indian culture where
Yeah.
they're crushing the herbs and spices. I
Mm-hmm.
think of our parents that are like, don't take that dermatine, take your green, take your ginger and your turmeric and
And
your
your mint tea.
parsley, and it's first before you eat anything. And
Yeah, yeah.
that's what I think of. And I'm like,
Mm-hmm.
are there flowers in it? Because we hear that people are eating dandelions and daffodils now, and they're
Mm-hmm.
things. So, talk to me about botanical medicine and
Mm-hmm.
how that's helping people in general.
Yeah, definitely. So that is one of the first things that brought me to naturopathic medicine because that is exactly how I grew up. What you're talking about, if your stomach hurts, go drink some mint tea. Come, let me
Right.
rub you down with some of this. And, and as a kid growing up, I was like, I don't know if this really works. But what was so eye opening was going to naturopathic medical school and having to learn all of the actual actions of these herbs and like physiologically what they're doing to our body. I was like, wow, they were doing something amazing. So I love botanical medicine, and I think it has so many different applications. There's actually three herbs I wanted to highlight and kind
Go
of
for it.
talk about today. So, in regards to chronic pain, there's a lot of different things that we can do. We never want to get into too many medications on a prolonged term if possible, right? And so that's where botanical medicine can kind of step in because of how it works alongside the body very synergistically. So, one of the first herbs I wanted to talk about was corydalis. So, corydalis is really great for pain conditions. If you have things like chest pain, headaches, abdominal pains, painful periods, things like that, it's actually a very potent anodyne. So an anodyne is a pain reliever pretty much. So pretty much that really helps to relax muscles. Anybody that struggles with really terrible muscular pains or chronic muscular pains, things like that, corydalis is a really beautiful herb for that.
Same, but
Huh?
spell that, spell that out.
Corydalis. Yeah, Corydalis.
C
So
O. Say it
C
again. C.
Cory, so Corey, and then Dallas, Dalis, all one word.
Okay.
So Corydalis, it's a whole species of one herb, but they pretty much all have the same action. So they are really excellent for that, but they do have a narrow window of application. So you can't have too much of it because it can be dangerous. So a lot of people think, oh, herbs are totally safe, they're totally fine, but you really do have to be careful, especially with some of these pain herbs, because at high potencies, they can cause like digestive issues or neurological issues and things like that.
Okay.
So Corydalis is one of the ones that you can, well, that under an advisement you could try.
Okay.
Pisidia is another one. Pisidia, the common word, is actually Jamaican dogwood. So
Spell that one.
Pisidia, Piscidia.
Okay.
Yeah.
Got
But some old like bush Jamaicans, they'll know this one. Jamaican dogwood. Okay, so Jamaican dogwood is one of our pain herbs as well, and it's a great analgesic again. It's a spasmolytic, so it helps relax smooth muscles, and it even has a little bit of a sedative action to it. So this is for people that have pain and are even not able to sleep because of the pain, which is a very common issue, right?
Oh yeah.
Yeah, so people that have very disturbed sleep, it's kind of just very relaxing. It relaxes the muscles, it relaxes you to be able to sleep so that you aren't experiencing that pain, so that you can actually have that time of repair, which is sleep, right? So that's why I love that herb so much.
Is it similar to melatonin in what you're saying that it does?
So the action of it is not. So melatonin more so works in the brain, whereas these herbs are going to go directly more to the muscles and to those organs that it's affecting. Hmm.
Okay.
Yeah, yeah. So melatonin is more of a nutrient, which is really good too. But yeah, sleep. I mean, the root issue there would be sleep, and they would both be ways to help improve it.
Now, you brought up the conversation So it's very funny because we always talk about side effects of the Western medicine,
Yeah.
but you brought up a very big thing in terms of their side effects to natural medicine.
Yeah.
In which case, some people don't realize that if you take something for too long, it
Hmm.
can affect you in the same way.
Hmm.
So, is there a place where two things? One, some herbal medicines can be replaced, can replace Western medicine because, from my knowledge, I know that a lot of the Western medicine actually comes from the herbal, but they've
Yeah.
just kind of redone it over again, right?
Exactly.
So,
Exactly.
is there a way for some medicine, because I use both,
Hmm.
to replace herbal with your Western,
Hmm.
but then are our physicians as knowledgeable on the herbal side, or is it important to be just communicative with your MD as well as your natural?
Naturopath. I know it's a big word too.
I have it. I really do.
Uh-huh. Yeah, it's so it's very important to be communicative. And, kind of just as a side note, so at the practice where I work right now, Integrative Interactive Health, I actually work with my sister who is a family physician. And so we have a collaborative practice wherein we really work together on cases, any cases that we have the same patient, and we make sure that we're on the same page with everything because it is definitely a concern. Safety in regards to making sure that your medications and any natural things that you're doing are not going to be counteracting with each other, right? So is definitely you should definitely have your team all on the same page. Is very
Mhm.
important.
And this is important, chronic pain conquerors, why you need to advocate and understand the medicines that you're taking and the
Mhm.
clinicians that you're talking with. And don't just wait for someone to sit down and give you the directions of what you have to do. You have to be that person that's like, I'm seeing X, Y, Z, and understand what every single person's specialist, clinician's position is and where things overlap. But you've got to be the one that communicates because all these doctors don't see each other. You may not be in the position that you are with Dr. Coleman's clinic, but in you knowing exactly what you do, you can talk to everybody about
Right.
what's going on. So this brings me back up to one more treatment that you guys do. And we've had a nutritionist on here before, but you say
Mhm.
nutritional counseling. And
Mhm.
so many people confuse that with diets and things like that. So can you tell us what a nutritional counseling is and what those differences are between when you hear the counseling and you just think overweight or things like that?
Mhm. Mhm. Yeah. So this is probably the hugest portion of my practice, or probably the thing that I spend the most time on, honestly.
Okay.
Because I feel like diet is kind of the root to really seeing a lot of the changes that people are desiring in their health. And
Mhm.
so from the very first appointment, everybody gets a diet diary. Doesn't matter what you're walking in with, everybody gets a diet diary. I need to see and know what exactly you're eating on a regular basis.
Yeah.
So we are going to sit down and analyze that. And when I say counseling, like nutritional counseling,
Mhm.
it's, what are the foods that you feel like you can't live without? What are the foods that, you go to if you're stress eating? Or what are the foods that you seem like are triggers for you?
It's my weakness.
Yeah, 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 exactly. And it's very common, but some people just haven't even brought awareness to it. That's the whole point of the counseling.
Wow.
Yeah, so it's about bringing awareness to what we're doing because then if we're more aware of it, then we'll be more likely to actually change those habits, right?
Mm,
So it's not about just me telling you, oh, you should eat this, 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 and this, and don't eat this, 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 and this. It's like, okay, how are you doing with this? Maybe we need to just tackle one thing at a time. Maybe the sugar is such a big issue. Let's just focus on that this month. Let's just work on, getting that down and seeing how that improves the inflammation that you're experiencing.
mhm.
Yeah.
Do you feel that people are educated on what they're actually putting into their bodies? Because it is the one thing that we hear across the board when we're dealing with health issues, chronic pain health issues, is you've got to watch your diet. And everybody thinks like it doesn't matter, but it matters.
It so matters. Oh man, it so matters.
So
I
matter.
cannot preach this enough. Yeah, like I do a lot of like health webinars on the side and stuff like that just because health education, nutritional education is so key. And I mean, I know that from the conventional medical side, a lot of them aren't necessarily trained in exactly what to say. But like for example, my sister will kind of be like, okay, you have diabetes and you should be kind of eating this, but I think you should see our naturopath because she'll be able to give you some more detailed direction as to how to go and manage this effectively, you know?
Keyword manage. That's another keyword that we don't
Yes.
use a lot.
Hmm.
Now, what does your patient's lifestyle look like after receiving treatments from you and your sister at your clinic? So, if someone walks in with extreme pain,
Yeah.
are they walking out completely okay? Are they walking out like a certain amount? Is they walking out more knowledgeable? How do they walk out? What does their life look like after?
Yeah, one of our main focuses, or our little tagline as a practice is better health together. And so that together is encompassing me to the patient, my sister to the patient, my sister to me as like collaborators on their case, making sure that the patient is heard. I want to speak on this, especially for this community. The chronic pain conversation is so important because as a naturopath, a lot of people will come to me after they've seen every specialist, they've run every test. People tell them, oh, you're crazy. Oh, you're not really experiencing this. Oh, it's not that bad. Oh, here, just take this drug, whatever. I don't
Mhm.
know what's wrong with you. Idiopathic, whatever, which is the label we kind of throw on everything when we can't figure it out.
Mhm.
But we're very passionate about really making sure that we have exercised all of our options. We've really under looked and diagnosed for everything and really validating the patient to make them know that we hear you, we believe you, and we're here to work with you and walk with you along this journey, of healing. And usually they feel very relieved.
Good.
If nothing else, yeah, they feel very relieved to hear that.
There was a point I remember about 2 years ago. There was a campaign that was really highlighting naturopaths because I feel like some people either don't understand you or are biased towards you, and even sometimes you hear the MDs seem to be like, "Oh, you don't need to go there." What is it that you want people to know about naturopaths so that they can bring in more, they can feel more comfortable coming to you or understanding the benefits that a clinician who studied for so long can actually do for their health?
Yeah. And thank you so much for that question, honestly, because that's kind of the platform that we all just kind of want to be able to explain. I know
Mhm.
that there has been a lot of skepticism because, some people do use the title naturopath, but they're actually not a naturopathic doctor. What that means is that they didn't actually go to one of the accredited schools and go through that whole program. And what that program really did was we learn everything that you learn in conventional medical school. I mean, pharmacology, physiology, anatomy, all of those things. And then we learn all of the different alternative treatments as well. And I think that's a little piece of information that would bring a lot of people peace of mind, because we're not just doing our holistic treatments without knowing for sure and studying how they can interact with whatever conventional treatments you may be doing. So we never want to make people feel unsafe, and so we have made sure that we get the knowledge that we need to be able to manage it from both ends. And I really love what you said earlier about making sure that you're advocating for your healthcare team and making sure everyone's on the same page about what you're doing. I know some conventional medical doctors don't necessarily see the need for it, but what I truly believe, what my sister as a family physician truly believes, is that both conventional and naturopathic medicine have their strengths and weaknesses. Honestly, we both have areas where we really excel, and there's areas in medicine where, there aren't as many options. And so if we work together and help each other out, we'll be able to do much more for our patients collaboratively and collectively, as opposed to just trying to box each other out, honestly.
So we're in Black History Month right now. And one
Mhm,
of the things that we're trying to do here at Chronic Pain Conversations is not, um, we're trying to approach this topic, but not from a Black power perspective, but from a Black knowledge perspective when it
mhm.
comes to chronic pain.
Yes.
So, my first question to you is, do you believe that people of color are educated on the topic of chronic pain and how to recognize the symptoms?
It is a huge disparity. It's very sad. It's a very sad disparity because we are so accustomed to struggling through it, pushing through. We're okay. We don't need, it's this fear of weakness or something. I don't know. But, it's okay to have issues, and your issues need to be addressed. And, I really love that you guys are focusing on the education. Health education is just one of the things that we're really trying to bring to the community, especially our communities, which I don't know if necessarily have been targeted as much to really bring these type of resources to. So that's why I love what you all do. I love chronic pain conversations. I want you guys to keep doing it. I think it's excellent. It's just another form of health education and bringing all the different resources and tools and things that need to be discussed to our community. So it's really great.
Thank you. Thank you so much. Okay, so I'm going to
Mhm,
ask your perspective on this. We brought this up a couple of times. So, in 2016, a survey was done by the National Academy of Sciences, and of 222 white medical students and residents, about half endorsed the false belief about biological differences between Black and white patients.
mhm.
This meant that they perceived blacks as feeling less pain than whites and were more likely to suggest inappropriate medical treatment for black patients.
Mhm.
As a clinician of color, what is your perspective on this?
Yeah, I know that, especially because I was practicing in the States before I moved back here. I was living in the States for a few years, and I was definitely able to see that disparity, especially there.
Mm,
And I'm just glad that they're bringing awareness to it now,
mhm.
because I know of patients that have come to me that have been like, I went to them, but they didn't really take me seriously. And it's hard to know sometimes if it's due to the color of your skin or maybe the doctor's just busy. But either way, it's really not an acceptable excuse, right? So
Mhm.
that's why yeah, it's really sad, but I'm glad that it's being highlighted now.
We have this thing where, we were talking about it earlier. We have this mentality. I don't know, again, it could be a slave thing, it could be a culture thing.
Mhm,
Unfortunately, these are the conversations that we need to have in these times of life. But do you feel like if we had, chronic pain conquerors of other ethnicities, Caribbean, West Indian, Asian, where is the place where you say this is your threshold for pain. You need to see a doctor no matter what after that. Because we deal with things like we've had conversations about arthritis with
mhm,
regards to like knee problems afterwards. And this could be stemming from you being an athlete in high school or
right.
college, and all
Mhm,
of a sudden your body's breaking down at 40, 50,
mhm,
and they're like, nah, I've had it my whole life. I'm just gonna wear through it. And they
right.
could literally be worsening themselves.
Mhm.
As a physician, what would you say to them? Okay, your pain level needs to only be at 3 or 4 before you need to go and see somebody. What would you advise for them?
Yeah, no. Anybody with those kind of long-standing issues, the thing about disease and symptoms, specifically symptoms are nothing but our body telling us that there is something going on that's kind of been going on for a while, and now we're expressing it. And so the more that we kind of ignore a symptom, ignore a symptom, ignore a symptom, that's when it allows other things to occur, right? So as you said before, it's just kind of not until things get from worse to bad, as they say, um, do you want to really try and address it. But naturopath, one of our principles is prevention is better than cure. So yes, before your pain gets to a 3 or 4, first of all, why are you experiencing pain? Let's just get to that root issue first. you know, like I don't really want you to be experiencing any severity of pain. We need to be doing things to try and address it. Keep it down to that 1 and 2. That's really my goal. I want your pain to be as minimal as possible. And if it's not there, let's try something else. Let's do something else. There's always another tool in my toolkit that I can.
I love that. Like that's a great way of saying it because
Mm,
you know, I funny enough, I have my apprenticeship in
mhm,
carpentry and there is always like you can have a screwdriver, if you've got a
mhm.
Phillips screwdriver, or sometimes we just go and take the kitchen butter knife
There you go. There
and
you
it's
go.
still there's more
Exactly.
than one way to get something done sometimes and and
Hmm.
there's nothing wrong with saying that you're not okay. There's nothing wrong with
Right.
saying, I feel a little bit off. Let me go and check something out. There's nothing wrong in
Hmm.
saying,
Hmm.
let me get a second opinion. There's nothing wrong with
Right.
saying, I don't agree or you're not hearing
Hmm.
me. There's a
Hmm.
lot of things that patients don't understand. They really feel like, okay, I'm just going to be like, okay, this is my elbow hurts and I need you to
Hmm.
fix it and give me the problem where we should be
Right.
saying, I hit the door 3 days ago. It's still bruised. It's
Hmm.
tender. Even if I shower with it, how do we fix this?
Hmm.
You know,
Exactly.
it's
Exactly.
now a lot of people again aren't familiar with the naturopathic, and we are, which is really funny because we were talking about 65 to 80% of Americans use it, so we are
Hmm.
familiar with it, right?
Right.
But sometimes we don't utilize it.
Hmm.
Is there any groups, specialists, or associations that can help our chronic pain conquerors find a naturopath such as yourself, either in the US or in Canada or anywhere in the world? What would they look for? Are there associations like there's psychological associations? What do they look for when they're Googling or researching?
Yes, so you can find any accredited naturopathic doctor through, if you're in Ontario, through OAND, which is the Ontario Association of Naturopathic Doctors. You can search, I'm in that database. It's a database of everyone that's essentially registered to practice naturopathic medicine in Ontario with a active
Say it.
license.
O-N-O-A-N-D.
Ontario OAND.
Mm-hmm.
Yes, yes. So
.com.
.org, I believe.
Thank you. It makes a difference.
Yeah, it does. It does. Because as I said, some people do use the title of naturopath, but they're actually not an accredited naturopathic doctor. So that is where you can search anybody in Ontario, or if you want further information on kind of naturopathic medicine and the accredited schools, the American Association of Naturopathic Doctors is also another place you can search.
Ooh, thank you
Mhm.
so much.
Yeah.
Okay, so we're coming close to an end, and one of the things that we like to do at the end with our guests is to share their quote that they gave us.
Mhm.
Your quote says, there is so much you are capable of with the right tools and support.
Mhm.
Just remember to give yourself grace and time to heal. It's a process.
Mhm.
Can you elaborate on where you got that, where that mindset came from?
That kind of just came to me, honestly, when I was asked about a quote. I have various kind of things that I use as my focus when I'm working with patients. So, one of the things I keep saying to patients is I'm not trying to address symptoms, I'm trying to address systems. So, I'm trying to look at the body as a whole. And as a whole, body, mind, spirit, mental, emotionally, physically, all of that, they all play a role in our healing process. And some things will heal faster, some things will heal a little slower. But giving yourself that grace and that time to allow for the body to do what it does know how to do, which is heal, is so, so important in your healing process. And the first part of the quote about, there's so many different tools. I never want people to feel discouraged or feel like they've kind of hit a roadblock in their health, because that's one of the things that drew me to naturopathic medicine, was that there's so many different options. Like, I talked about some of the modalities today, but that wasn't even all of them. There's just so many things that we can try, so many different avenues to go as far as really trying to get you to where you want with your health. So yeah, that's
Awesome. Thank you so much. You said that if they wanted to, it's the American Association of Naturopath.
naturopathic physicians.
Thank you. We will edit that and make sure that that is good. Okay. I'm going to give you a moment so that people can find you
Mhm.
where you are. So if you just take a moment to let them know where they can follow you, find you, things like that, we will definitely, as usual, if you're following us, her details will be in the post in the description. But for those watching us, can you just let them know where they can find you?
Yeah, so our practice is on Instagram and Facebook. You can follow us at the letter I, two, the number two, health. So that stands for Integrative Interactive Health for short. So yeah, we do a lot of stuff on our Instagram page. We're very interactive, hence the name. And we do things like exercises on Thursdays and meal Mondays and things like that. So definitely follow our page. You'll get some nice resources there. And if you ever want to come become a new patient, I am accepting new patients at our clinic. It's at Cawthra and Lakeshore Road East in Mississauga.
That's Ontario, Canada, you guys.
Yes, Ontario.
We have people from the
Sorry if you're outside
UK.
of Ontario.
I have to say Ontario, Canada, because there's Ontario, California. And I'm just like,
That too. That too.
I just want to say thank you, thank you, thank you so much for coming on. You have educated me and so many of our chronic pain conquerors about what it is that you do. I honor you and I thank you for the job that you do because, not everybody wants to get into it. Not everybody wants to help, and everybody has their own vision and mission in life. So I'm very thankful that you've chosen this path, you and your sister, and you are helping so many people. So if you have the opportunity, you guys, check her out, follow her, see what information's out there. If we can follow everybody on IG and they're just putting up pictures, follow them because they might be giving you some really good information. I found about words today that I didn't even know how to spell. So thank you. Okay.
And thank you so much for having me. I really love what you all are doing on chronic pain conversations. Keep it up,
Bless your
definitely.
heart. So
Excellent.
I'm just going to take you off and put you in the backstage until we're finished. So just give us a moment and I'll be right back with you. Okay. Wow, guys, what do you want me to say? That was such an amazing and interesting conversation. So I'm just going to pull up a couple of things that she said earlier for those that were watching. She mentioned the word cordalis with regards to some of the herbs that are available out there. And then another word was, oh God, Piscazia. I don't know if I can say that right or not, but this is how you spell it. So if you have any interest in finding that, fine, you can go there. Also, remember that if you're in Canada, there is the Ontario Association of Naturopathic Doctors.org. If you're looking for someone closer in your area, and if you're not and you're someone that's in America, well, there's always the American Association of Naturopathic Doctors. So there's definitely a lot of resources that are out there for you. And I know that some people are going to be like, well, my benefits don't cover it, or you never know who is out there and who's able to help you, what their prices are. And if we're spending money on shoes and wallets and games, we can put a little bit of money towards us. As you heard at the beginning of the show, 65 to 80% of Americans are paying this out of pocket. That means that they're finding value and worth in these types of clinicians and specialists. So make sure that you get yourself out there as well to find out what's available and who can help you. Okay. So, what I want to do right now is take it to our, as usual, keep it moving moment. And today's keep it moving moment says, The food you eat can be either safest or most powerful form of medicine or the slowest form of poison. I'm going to repeat that. The food you eat can either be the safest and most powerful form of medicine or the slowest form of poison. That is such a really big thing if you think about it. If we're putting in a lot of food that's just sugar, 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 and they're all different forms of bread and sugar in our coffee and our tea and sugar in our chips and all of those other things, that's causing your body to slow down and break down. And there are even fruits and vegetables that might not be good for you because your body might have IBS like I do, or it may not be able to tolerate it. But if you're knowledgeable on what your body can digest, what is good for you, what will give you your iron, your zinc, your protein, what will be able to be good for your bloodstream and help you be immune or just boost your energy, those are the things that you want to take a look at. We have a long life to live and you want to live it to its fullest. So, guys, that's our show. My name is Kalila Bruswell and I am the Overcomer. Normally, you would be here with my co host, Ms. Sharifa McLaren, but we will be back next Tuesday at 12 p.m. Eastern Standard Time, 9 a.m. Pacific Time, where we will be having a conversation on Disease Day with Marianne Peluso. I'm really interested in that. As you guys know, we're always trying to highlight the dates that we don't hear so many things about, and Rare Disease Day is coming up. So I just want to make sure that you guys know that you can follow us on Instagram or Facebook at CP Conversations, and on YouTube if you want to see any of our prior videos. Sorry. But also, if you're hearing something like Rare Disease Day or you are a chronic pain conqueror and you are turning into a place where you want to advocate, you want to bring awareness about your pain or your chronic disease and illness, or you're ready to share your story with the chronic pain community so that others know that they're not fighting alone, well, we invite you to be our guest by filling out our Share Your form on any of our social media bio links. That's it, guys. That's our show. So we want you to remember the Chronic Pain Conversations is the show that enlightens and advocates about chronic pain. We hope that you have an amazingly blessed week. See you next week. Bye.